Hi, my name is Beth Morrell. I am a pediatric physical therapist and pelvic floor therapist as well. I have two kids and they have been on an airway journey their whole lives. Both were born with tongue ties and we've been working, through body work, palate expansion, the whole gamut, their whole life, tongue tie releases in order to basically get their airways up to snuff so that they don't end up like the rest of the world with this sleep apnea epidemic. And because of that, I know, and because I work in this space, I know way too much. And so Dr. Elmore is my colleague, actually. My kids have had ALF, the ALF palate expanders, since they were very little. My little one got his at 2.5 years old, and my older one got hers at 4.5 years old at the same time. The pandemic hit in 2020, and because it was during that time period, they had their ALF in actually a very long time. So although that really did help grow their face, grow the chin nice and forward, grow the chin or the mandible as wide as it could get, very happy with the results that I got there. It did also then, steamroll the effect on their teeth themselves, because the ALF sits on your teeth, and because it's a permanent appliance, you're not taking it out to brush your teeth, this, that, and the other thing. So after the ALF is off, we are left with tons of inflammation in the body, which my kids have underlying inflammation, inflammatory issues, autoimmune encephalopathy. And so because of that, with inflammation in their mouth, they both had tons of dental work to do. Restoration, cavities, inflammation, gum issues that we needed to work through. I went to the regular pediatric dentist by me, actually the general dentist first, and she, got nervous and said, "Oh my gosh, there's so many things going on. Your kids need so many root canals. There's no way that we can save all these teeth. What happened with this palate expander? Did it ruin everything?" And although that, was a little bit alarming working in this airway space, I was like, no, let's calm down. The palate expander did what it was supposed to do, and we have to fix everything on the back end. So I'm definitely happy with the way that things went. Although we are a little bit unlucky because of the autoimmune encephalopathy and inflammation within the body, we are now left with some, kind of pieces to pick up. So I took the x-rays themselves and sent them to my colleague, Dr. Elmore, who immediately called me and said, "Listen, these x-rays weren't taken from the right angles. Also, they're not pediatric size, which makes a big difference in terms of fitting them in your mouth, which then changes the angle that you get them from and what you can see with and without." And, she just started going through this in-depth explanation of how we don't need to pull X, Y, and Z tooth if there is X, Y, and Z answer, and this tooth doesn't need a root canal if this blah, blah, blah happens. And I was like, listen, being a pediatric specialist, let me let you check them out. Dr. Jasmine, also being an airway specialist and my colleague, I really trust her opinion. So when we got down here from New Jersey to North Carolina, which is a good 8 hours, time well spent, that is not an issue. And we retook all the x-rays, and then we can, formulate a working plan of what is actually going on in my kids' mouths and what should we do from here. So we had a lot of work to do, and we kind of went through it. My daughter was first. There are a lot of treatment options here, and this, Dr. Elmore being a holistic provider, me being a very holistic mom, Western medicine has its time and its place, and so there are one or two things that we did that can be considered a little bit more Western medicine. However, for the most part, we stick to natural, more natural choices and homeopathy when we can, all of those good things. So number one, we do not use fluoride-based products or fluoride-based sealant, right? When she worked out those cavities, and she works with the ceramic style restoration, which is top of the line and much healthier for the oral microbiome. Obviously, like I said, we used pediatric x-rays, which are smaller and way more easier to manage for the child themselves, and we needed to go back and forth with them. It wasn't such a big deal. The biggest thing is that we also, newsflash, have Ehlers-Danlos in our family, and because of that, which is a connective tissue disorder, because of that, we have difficulty getting numb. It is a side effect and part of Ehlers-Danlos. And so Dr. Elmore was like, no problem, I have the solution for that too, which is using a buffered lidocaine solution. And so when you buffer the lidocaine, it goes directly in, and it doesn't take so long and so much medication in order to numb. My son, when we just did his restoration work, got numb immediately. Like the needle went in and he was like, what's happening? I'm numb. Amazing. I was like, this is great. So that was another huge plus. That is my biggest gripe with going to the dentist. It takes me a very long time to get numb. It takes me a lot of medicine to get me numb. I have woken up during countless surgeries, which is very unfortunate. But thankfully for my children, this does not have to be an issue. And so that is one thing that I would come, and pay time over time and be eternally grateful for, just on the fact that we are comfortable. And with that being said, we did not use any nitrous. We didn't need to use any nitrous because my kids don't detox nitrous well. And because she's, so good at her job and she makes you so comfortable and the office is so comfortable, that there was no pressure. And because there's no pressure, we didn't need nitrous as an extra layer of sedative, because there's no anxiety within the dental office itself. Dr. Elmore and her staff are very patient, so they will work with your family. They've had patients who have had come from other places because the dentist was too impatient to work with their child. But that is not the case here, and I'm so proud for her to be my colleague and also my friend, because she is such a wonderful person. So that nitrous was not even needed, and maybe it's not needed for your child either. I know that nitrous and ozone, those are all options. Homeopathy, in terms of pain relief and healing, she has done extensive coursework on that, and those are options as well. And it is just an easy trip for us to come all the way from New Jersey to get what we need done. And we'll continue to come down here for however long we need. So we are eternally grateful for Dr. Elmore as a dentist, and we hope that you will be too.